in my clinical practice, we treated a lot of pneumonias in patient. Now, you would think that pneumonia has been known to the world for many, many years, and we already know how to treat it. Well, and indeed, if you look at the guidelines, you would see that all of the antibiotics are spelled out. There is a nice graphs on how to estimate risk, how to pick your drug, and they outline some of the gaps that relate to more intricate details of treatment. Like, for example, are glucocorticosteroids effective when used in combination with antibiotics? So that's an interesting question on its own. But in fact, I want to take one step back because what I saw is that within our department of, I want to say 10 people, each of those 10 people treated patients with pneumonia without other comorbidities, otherwise perfectly healthy, differently. So one would take one drug, another would give another drug. Some would use injections, other would start with orals. So there was a high heterogeneity even within one department, let alone a hospital or many hospitals. Now, back in the days, I couldn't really do much about it. But now, when I'm in Odyssey, Odyssey is actually perfectly suited to look at how those patients are treated. So, what we can do as the very first step is to just look at treatment patterns for patients with community acquired pneumonia. And because we have many international data sources with different provenance, we are uniquely equipped to look at this problem at scale that nobody else can do. Nobody else in the world can actually characterize the treatment at scale. So I think there are more interesting questions down the line, but this very first simple question of just estimating how much heterogeneity there is would be very beneficial for the downstream analysis. And I feel that it would be a very useful paper for the community.